Welcome everyone to our winter AETC program eLearn committee call. It's just before 1 o'clock and I think we'll might as well just get started. We have a lot of information to cover and we have about 45 minutes to do it in. So I just want to start off by saying typically this meeting happens in December, but with the Ryan White All Grantees meeting coming up and the clinical conference along with the holidays, we decided to move it to November today. So this will be our last eLearn call for 2018. Today's session is on the MidAtlantic AETC Learner Education and Practice Portal, or LEAPP platform for data collection and quality management. Our presenters are Dr. Linda Frank, Professor of Public Health, Medicine and Nursing, Principal Investigator, and Executive Director of the MidAtlantic AETC, as well as Matt Garofalo, Distance Learning Specialist, also with the MidAtlantic AETC, and Hathy Simpson is on the call as well, Program Manager of the New England AETC. Before we begin, just a few reminders. If you've dialed in, please mute or turn down your computer speakers to minimize background noise we might hear or any interference. If you have to take another call, please do hang up and call us back if you're able. Do not place us on hold so we can avoid hearing your hold music. And the meeting is being recorded. The slides and the recording will be posted to our website after the call. Let's see here, moving on. So the MidAtlantic AETC developed and licensed the LEAPP platform through the Innovation Institute at the University of Pittsburgh to help support the work of the AETCs and related communities of practice, ultimately to help assess and improve the delivery of HIV care. So Dr. Frank will lead the session and provide an overview and the rationale for the development of the LEAPP platform. Matt will then identify some of the necessary steps for implementing the platform. And because the New England AETC has integrated and is currently using this tool and is working closely with the MidAtlantic AETC through the process, Hathy Simpson is also on the line to answer some questions about its application and to provide me perhaps some examples about how it's being used in their program. So without further ado, I will turn it over to Dr. Frank to begin the session.
Hi, good afternoon, everybody. It's great to be here. And I want to thank the NCRC for the opportunity to talk about the Learner Education and Practice Portal, something that we're very happy about, not just for our AETC, the MidAtlantic, but because we've been able to disseminate this platform, and it was adopted by another AETC. So it provides an example of how, going forward, I think we should figure out more opportunities to work together on things like this, because I think it does help to prevent duplication of effort, and ultimately I think it may be an opportunity to save some money. But let me first talk about the AETC scope of work. It's the same as everybody else across the country. We're doing core activities in communities of practice, preceptorships, consultation, coaching, and then we have our practice transformation projects and our IPE and the Minority AIDS Initiative. Those haven't changed in the new FOA. There's been some things that have been added, but it's pretty much the same. And one of the things that I wanted to point out about this platform, the Learner Education and Practice Platform portal, is that we started about 6 years ago in developing this. This hasn't been something that we developed overnight, and it grew out of need to respond to the expansion and ongoing changes in data evaluation and program tracking that have been required of the AETCs. And it became clear to us that we really needed to develop something that would be nimble and that we would be able to alter as things continue to change. because as we know, the only thing that we can be sure of is that things will change. And when you think that things are going to be absolutely the same, you're always surprised at how they do change and how quickly they do change. So we wanted that ability. And we also wanted it to be user-friendly and meet the needs of trainees who come to our programs and our regional partners in the Mid-Atlantic region, and for us here at the MidAtlantic AETC headquarters. And so those were some of the defining things that made us move in this direction. And it's not been an easy process, and it's not been an overnight process. But I think we have something now that I think is very usable and very, it provides us with what we need, and it also is going to help us to provide what we need for the future. So the LEAPP system was specifically created to support the unique needs of the AIDS education and training centers. This is not a off-the-shelf product. This is a product that we have developed with our developers here in Pittsburgh. It provides a centralized web presence to facilitate the interactions of trainees with educational programming of the AETCs. It supports recruitment of our trainees, the tracker of user activity, data collection, and facilitates collaboration among our educational partners, like the other federal training centers. And currently, and it might be even more than that now, we have 20,000 users. 25,000 users. So it's changed. And it keeps going up. And becoming a user means you have to log on to the portal and create an account, just like you would with Amazon, although Pittsburgh doesn't want to talk about Amazon today because we were up to be one of the new headquarters, but we didn't get it. But anyways, the other thing that I think that the Learner Education and Practice Portal does is it provides a way of branding the work of the Mid-Atlantic AETC. And if you talk to people throughout our region, they recognize the HRSA logo, and they also recognize our Mid-Atlantic icon that we also use. And so we adapted this product to the requirements that HRSA gives us, the needs of our audiences. But we found that at a certain point we decided that we really wanted to get it licensed. And so we have this thing at the University of Pittsburgh called the Innovation Institute that licenses all kinds of products produced by the University of Pittsburgh. And we submitted it to the Innovation Institute. And they were very excited about this product and helped us get it licensed. So it is now licensed as a software as service. And Matt can talk about that a little bit more as he goes on with his part of the presentation. But it's a platform that's specifically tailored to the AETCs to respond to change. And LEAPP stands for Learner Education, Practice, and Portal. And we developed this name for it because we thought it was very intuitive of what we really wanted to do. It talks about what we do with this platform. And so that all learners are encouraged to participate in programs both in real-time, distance-based, and on-site. We, of course, provide education to improve knowledge and skills, and we really want to change practice. And it is focused on building the capacity of healthcare professionals, and we really want to influence the way people practice and the way people interact with their clients, among other things. And it's a place where everybody can go to get the information that they need. So it's our trainees, it's our regional partners, Our regional partners can go to this site and look at their own data and figure out, oh, I should be doing more of this or more of that. Am I meeting my goals? They can look at all of their own data, as well as we can look at all of it here at the University of Pittsburgh. And I just want to say one thing about LEAPP, and one of the things that became clear when, over the last year, we went up to meet with New England AETC to talk with them about this product. We went to their faculty development and talked about LEAPP and how it could be used. And one of the things I always say about this product is that LEAPP in itself is transformational. This product helps to transform the way AETCs operate and the way that they interact within their own group. So one of the things that it's done both at our AETC and I believe also in New England, it has enhanced RP interactions with the center headquarters, with us, within the MidAtlantic AETC. And I would venture to say that it's also done that in New England. Hathy can talk more about this in the question and answer period. It enhances regional and partner engagement in data and evaluation. It's just not that the center headquarters is doing data and evaluation. Everybody's doing it, and everybody is part of it. And so it makes the data collection and the quality of the data much better, and it makes our evaluation activities more robust. It enhances peer-to-peer learning among and between the regional partners. We have all kinds of places on our website that people can go to look for information, and we can have, chat rooms and all kinds of things, which you can do with all kinds of other products as well. But I'm just saying that we do it here, and it works very well. And it enhances our MidAtlantic AETC community of practice. So I consider our group, our regional partners, and the center headquarters, in and of itself, a community of practice. And even within that large community of practice, there's other communities of practice within our group. We have a practice transformation group. We have a IPE group. We have an MAI group. So this is the definition of the community of practice that's in the data manual. It's a group of people who share knowledge to develop a shared practice. A community of practice may use different modalities or interventions to obtain a shared outcome. That's what's in the data manual. And that there's various domains, there are various defining components of a community of practice. Knowledge, the domain of knowledge. It defines a set of issues, creates a common ground and a sense of identity. So everybody that's working on practice transformation, all the coaches, they have a specific identity, issues, knowledge, skills that they have in their building. The IPE group is similar. And we have all kinds of other groups within our AETC that I could talk about, but I won't. And then there's a community of people, again, fostering interaction and trust and concern and caring about a particular domain, and a shared practice. And that is developing a set of ideas, tools, information, styles, language, stories, and documents that people can share. And so when I think about communities of practice, in my mind, and one of the reasons why we thought about, working with New England and allowing them and working with them to adopt this platform is because the AETCs themselves are a community of practice. All of the AETCs together are a community of practice. And I think going forward, I think it makes sense for us to try to develop that more. Because I think lots of times people develop the same things in parallel. And I think a lot of time is wasted, a lot of money is well, I'm not sure it's wasted, but a lot of time is utilized, and a lot of money is utilized, and people are developing similar things down parallel tracks. So, rather than, being doing parallel activities. We should be doing more joint activities, in my mind, but that's just me. Okay. So this is a schematic that I developed for the last application that is sort of a picture of what communities of practice are. And I'm not going to read it to you, but you know, it can be a network of many things that, and of many groups. And when we talk about practice transformation, you know, all of our practice transformation sites in our AETC that we've been working with for the last 4 years are a community of practice in of themselves. And then within those individual clinics that we're working with, they have their own community of practice. So it just goes on in terms of the kinds of communities of practice that you can have. And you can have discipline-specific communities of practice, issue-specific communities of practice. So there you have it. And this platform helps us to do that and to support those communities of practice. So I'm going to turn it now over to Matt, and Matt's going to talk about the operations of LEAPP and how it all works. Matt.
All right. So I just want to get started with how what Dr. Frank was talking about is how we started this. We started this basically out of need. We needed a way to keep track of all of our activities that our regional partners were doing, what we were doing, and to put it in a centralized place so that we could track it over time and track it live. When I first came here, I saw that a lot of this stuff was done monthly. When you're talking about LEAPP, whenever somebody creates an event or whenever somebody adds participants to an event, you see it live as it's happening, and you can export things off of LEAPP live and keep track of your stuff more actively than you would otherwise. But one thing I do have to mention is that LEAPP is not a perfect product, but no technology product is perfect. One of the things that we try to do is we try to fit our practice or our processes around the technology, and then as the technology changes, we then have to again change our process. I think that's been one of the major challenges in expanding this, and I think that Hathy can talk to that later on as well. But as we expand it to New England, and I think we've done a pretty successful job. We've noticed that not everybody's processes line up, and the best way to do it is not to adjust the technology so much to fit the process, but fit the process to the technology. And there is some hybridization there where you have to kind of do a little bit of both, but for the most part, you want to change to match. So with that said, this is a very simple interface for users. You go on with whatever you have, your computer, your phone, your tablet. We have a very simple login, not something that you all haven't seen before. Basically the idea was to draw everything into one spot. Our website, our registration, our ERs, our PIFs, and now our evaluation, as well as the tracking of our regional partners, their activities. So you're able to do that by identifying roles for the different individuals in the system. You can see there are all the stakeholders. In the system, you have many different levels of roles. You have the very basic user. Then you have site admins, which can control the information and creating events for their site or activities for their site. You have the regional admins. That's what Hathy is for the NEATC, and we have one here for the MAATC. Basically, that is in control of the entire website instance. So when I say website instance, I'm going to say it again during the call. That is the instance of LEAPP that is presenting as your domain. So that would be like www.neatc.org. So, or maatc.org. So that's the instance. And then you have the system admin. That's myself and a few other people here who kind of support every instance of the domain that we recreate. And when we recreate the domain, the whole point was to track that process data, the PIF and the ER, and track all the modalities as well. Some of the ways that we support this is through registration for trainings, profile tracking, surveying of change and intent to change practice, and then the online resources as well. So there's sharing. There's a Dropbox in there as well as privacy and access controls. All right, so hold on one second. So the HRSA defines the community of practice as we talked about this earlier. So the community of practice as HRSA defines it, and the community of practice as web people define it, are slightly different. Usually when you talk about a community of practice on the web, you're talking about a domain. So like Facebook is a domain or a community, or like a group or something like that, a forum. So that's usually what you're talking about. Is it's usually identifying, the community is identified by the domain that is presented with for the community, rather than for us, our community of practices tend to be clinics. So what we've tried to do is we've tried to make what the web sees as a community of practice match what the clinic sees it. So by making private pages and private events that only those clinics can access and go to. So you saw that schematic before. I'm going to switch back to it. So you see these, all these nodes, and then there's connections between the nodes. So if you notice there's two nodes here. That's a one connection. These if you go to this side, you see there's 3 nodes, 3 connections. Then 4 nodes, you have 6 connections. So that grows logarithmically. So that's what's called your network value. So that's how many connections you can create, or how many different ways people can access each other through your community. So the whole idea is to optimize that and to utilize that. And so network capacity or network value doesn't necessarily equal utilization, but that interaction between the different people in your community is really, that's where you get that utilization, and that's really what we're shooting towards, is more interaction between those different members. So some of the data on LEAPP, I can talk about this, or I can just show this to you. So I think that's what I'm going to do now. We've talked about it enough. I'm sure everybody wants to see it. So LEAPP actually, so there's, it's kind of funny how this works here. So LEAPP actually has its own website now, atctraining.org. On that website, what we're able to do here is we're able to create these other 2 instances of LEAPP. So you can see here, this is the Mid-Atlantic instance, and this is the New England instance. They mimic each other in a lot of ways, and that's part of what LEAPP is that whenever you create a feature, because it is all mimicked through the same website, the feature then propagates to both sites. And what that does is it adds to cost savings. So for example, if something like adding evaluations is added to this, or this training calendar, it will go to both sites, because at that point, each site doesn't have to pay for their own version of that thing. So that's really where the cost savings in LEAPP comes into play. So let me show you what it looks like from the front end. So from the front end, as a user, you can go in and you can view trainings. You can sort by all kinds of different things like the sites, keywords, credit offered, and different things like that. And then you can register. Now, if you've registered before, it's really easy to register again, because you just have to log in, then you go back and you can go to register for that site. What you do is you review your PIF, and then you hit submit. What happens is once you hit submit, you'll have that saved under your event registrations. So you can see here, these are ones I've registered for already. I didn't want to mess with one of our live sites, but you can see they can cancel their registrations and different things like that. Also, from this profile, you can see you can edit your PIF information. your account info, and then there's these other features for access. These are those community of practice features that I was talking about for private pages, forums, and private events. Also, what's new in the system is there are these surveys that go out. This is the JSI surveys. Those are tagged to an event, and so whenever somebody registers for that event, once the event has passed, you'll be able to see this add submission thing. And also the required reminder emails come out from the system as well. So that's pretty easy there. You'll also notice this request assistance is here at all times. That request assistance is just a simple form that creates a ticket, which helps us monitor across site and forward to our regional partners what's appropriate for them to answer versus what's appropriate for us to answer. So right now I am logged in as a system admin. This is the highest level that you can be logged in at. Because of that, I have this tools feature. These are all the features allowable on LEAPP for change. So as you can see here, it encompasses all kinds of different utilities within the system. So you have content management, which is your event listing, forums, pages, just your simple content pages like this here, and you'll get these notifications for ease of use too. That whenever you go to one of these pages, if you're an admin, you're able to make the changes right then and there, and it's as simple as making a click to see that. So let me go to the events, because the events is really the core of the system. It's what we built for first, and it's what we use to monitor how we're doing as far as our process data with the grant. So you can see here, as a system admin, I'm able to see all sites. If I was specific to one site, I would only see, this filter would be automatic, so regional partners are not able to change other regional partners' information. So this allows us to see everything, but also limit what other regional partners can do or change, or how they can affect the other users on the system. You can see there's actions here allowing us to edit details, duplicate items, delete items, and export. If there were evaluations associated with either of these programs, we could export the evaluations from here. Also, this filter is really important. So the filter over here on the right-hand side allows us to pull very unique reports for HRSA. What this does is once we pull these reports, we're able to download it in HRSA format. So that just makes it a simple click and submit whenever we do this at the end of the year. All right, I'm going to move on to users. So one of the things that we've been doing since the start of LEAPP is we've been saving user data that they can access. So here you can see a listing of all our users. So yeah, we're close to 25,000 users here. I spoke too soon, 24,441, but we're getting there. Yeah, we're getting close. So you can see there's a basic interface here of sorting. You can sort by these columns, and then there's more intense filtering on the side that allows you to pull your email list, allows you to sort by speakers, allows you to do date ranges of when they logged in, and also the grouping thing that we talked about earlier. So this differs. So another thing we have is registrations. Now registrations are different from users because registrations are receipts, receipts for attendance, whereas users are a user profile. So if you buy something, it doesn't. Every time you buy something, you receive a receipt. That's what this is. Whereas it doesn't necessarily delete your user account or change your user account. You can have multiple cards with a user account, just like you can have multiple emails with our user accounts. So it works very similarly to how regular transactions work in the business world. And that's really what we've been trying to do, is we've been trying to match what's standard-based to what we're doing, and trying to build that in a way that makes the most sense and is the easiest to navigate. So let me go back to creating an event. So a new event, I'm going to edit an event rather than go to a new event. This is going to be one of our webinars. So when you go to create an event, you'll notice that there are a lot of details that you can add to the event. We've broken these details up into a dashboard so it's easier to kind of sort through. So right here you have your standard data that you need to get it onto the system. You have your agenda, your description, your HRSA topics, evaluation. So what's neat about evaluations, this is something that I think we're doing that I don't know if anybody else is doing, is that whenever you create an evaluation, what happens is you only have to create one evaluation for like the core IP evaluation. And the reason is that what our system does is it takes information that should be exported to HRSA, for example, the title of the program, program ID, and it takes that from the ER, and it uses that, it adds that to the top of the evaluation so that you don't have to fill it out whenever you go to enter it in. So this is different from Qualtrics in the way that when Qualtrics does it, you have to go recreate it and you have to add that program ID and that title for everyone. Here, to add an evaluation to an event is a little bit too easy. So you just go here and you click on that evaluation, and then that's it. And then you can decide if you're doing this a paper evaluation, you can not send it out to them. If you are doing it as a email evaluation, you can send it out to them. So very simple interface, and you know, we're adding the follow-up here in a couple of weeks too. So the follow-up will also be part of this, and it's going to work exactly the same way, except for there will be no option to send out that email because they'll all be emailed out for the follow-up. So I'm not going to save that because I'm not sure what they want to do here, so we'll keep on going. So we also have some access features for registration. There's confirmation emails. There's access codes, so you can lock down an event for only people who have the access code. Max registration, event fee. Post-registration redirect is pretty cool because after they register, what it can do is it can open up another window. So, if, for example, it'll start playing a video when you're done, which is really good for our archived webinars. And then we have some tracking here. You can track by credits and speakers, and you can track by groups. Grouping is basically used to, is a catch-all. So if there's something that HRSA is asking us to keep track of, we create a new group and we start tagging all of our events as that group so that we can find it later when they ask us to report out on it. Then finally, closing requirements. This is our standard form. I'm sure that you all have seen something pretty similar to this. So we punch that all in as well. And then you can add materials to your events. That's self-explanatory. Those materials can be private and public, so that helps with fair use laws. Private means that only people who have gone to the event can see it. Public means that everybody can see it. Also, we have this committee portion. This committee portion is for collaboration, so if you want to make it so that somebody you're collaborating with can see, edit the event or view registrants, you can make that possible. It also helps for collaborating across regional partners because, like I said, you're not able to see each other's events. And then this is the part I like the most, the participants panel. So if there's already a user account for the person, you can just find that person and add them to the event as easy as 1 or 2 clicks. So that's something that's very, very helpful for whenever you have your ongoing or community or practice groups, and you just want to, add like a whole group of people to it just by finding them on the system because you know that their PIFs haven't changed, and you want to just make sure that you add them. You can also duplicate. When you duplicate, you can carry over participants too. So it makes it basically this side of it is really the side that makes life easier for the regional partners. Oh, and also you can delete people who don't attend. Sorry. So that's just this little trash can here. And then you can export all this information here. There's like 100 different places on the. We made it so that every time somebody asked how to export it, we just added a new export button on there, so you can export it from all kinds of different places across the system. And then there's a log and notes that kind of keeps track of everything, so that somebody can't say that they did something and they didn't. So that's also there. Now, there's one part that I didn't mention that I want to go back and talk about. So one of the ways that we help keep track of our regional partners is we have these different statuses. So these different statuses are extremely helpful in the fact that when they create an event, most of the time when you're creating an event, you don't have all the information on hand, or you don't know you don't have it until you start making it, and you're like, oh man, I forgot to ask them who the speaker was, or oh, I forgot, I don't have the objectives. So you can create something in draft form, and the way this minimizes the effort for approval on the headquarters, they can create it in draft form for as long as they want. As soon as they want it to go live on the website and how we quality manage this, they can submit it, and once they submit it, then it goes into review. I don't know if we have any in review right now. We do. So in review means that the regional partner is not allowed to make adjustments because we're reviewing it. This is when Dave and myself and Susan, we go in there and we make sure that everything's correct, everything fits with our goals and objectives for the MidAtlantic AETC, and then we either come back with suggestions or we will just open it up and say, go for it. I hope you get a bunch of registrations, and then people can start registering. So it allows for that option as well. So then it moves to open. Open means it's live and visible on the website. And then also the last one is closed. So closed is important too, because that tells our data manager, Susan, that they're done with that event. So that means that once they're done with the event, they can't make any more edits, and Susan can pull that data for HRSA, and she can run it through all the queries that she wants to run it through without worrying about them changing the information live on the website because it's already been closed. So this really helps with our business process, a huge deal, because we have all of these steps that make sure that things are happening correctly. And there's also validation in the system, obviously, that makes it so that you can't do something you're not supposed to. But then we have the additional validation of having somebody, a person, check it as well. Okay, I talked faster than I was expecting. Okay, so let me show you a few other features on the system. All right, so there's also a very basic content management. So, for example, you have this top navigation, so you can create navigation features for that as well. And so you can see listing here are the navigation features, and then you can edit the order. So we have a lot of little content management features as well. When you build the initial website, let me log into this. So the only issue when you add people to the website is moving over the domain. Other than that, everything is created from this section. So this section here allows us to create new AETCs. So, for example, a new instance, or I'll show you our current instance. You can see you can pick your colors, you can pick your images, your homepage information, allows you to identify what email it goes to, evaluation links. There's a lot of information that goes into actually building the foundation of your website. Once you have that built, you can notice the colors match, what you see here. So it can be easily changed, but it's something that we have only available to the system admin. So once we build that, then it's pretty standard and set once it's started. But you can see that allows New England to have a different color scheme than us, so they differ. So one last thing I want to mention is I'm going to go to this home page. Oops, that's not the home page. I'm going to go to this home page, and just point out something here. So the way this is built is it's built in pods. So what I mean by built in pods, I mean each of these sections is built to do its own thing. And so what that does is we've done that for all the features on the site too. So notice all these features do kind of their own thing. So this makes it much easier for development. So we can change one pod at a time or make changes to one thing at a time. So it makes it easier to contract. It makes it's more lean when you do it that way. And it also makes it so that, down the road, if we want to change this, all we have to do is move pods around rather than redesign the whole thing. So we can move pods and change the colors, but that doesn't necessarily, lose the information that is the pods are generating. So that's another unique feature with our system. And one of the reasons we decided to build it ourselves is because whenever there's a, when I was in school here, one of the things they would always say is whenever you have to adjust more than 10% of the code for a existing or off-the-shelf product, the better choice is to go and create a custom product. Because if you're changing more than 10% of the code, not only are you having that big upfront cost of the off-shelf product and all the development, but also you're going to have your own development. So you're still going to have to hire developers. So in that sense, you're almost better off creating a product that is specific to you and specific to your needs. And like I said, LEAPP isn't perfect, but we're getting there to a point where it can do almost everything that we need to do to run our AETCs, and it allows us to do it with, it allows us to do the things that we know how to do best, which are training healthcare professionals and healthcare professional teams about HIV. Not entering in data, not data entry, not tracking of events, not event planning. What we know how to do is train people about HIV care, and that's really the core of what we should be doing. So centralizing something like this and centralizing all the administrative stuff makes it much easier for us to concentrate on what we're best at, and makes it easier for our regional partners to be as productive as possible.
Oh, yeah.
And that is all I have to say about that, because I need a drink of water anyway. So I'm gonna actually pass it off to Hathy. Is there anything you wanted to add since I'm finishing up here?
I'll just give a brief reasons why we made the leap to LEAPP. That we were having a lot of problems with our old data system. It wasn't user friendly at all. It was an access database, and we needed to change that to meet our needs. It was very clunky. It was not a lot of interaction among the regional partners. And I would say a bonus for us was the public face, the website that comes along with LEAPP. It was like a 2-in-1. We had problems with our old website. It was an outside contractor. It was difficult. Every time we wanted to make one little tiny change to our website, we had to go through this big process. So we ended up not making changes until it was, until we had a lot of changes to make at once. And it's just been, I would say, a really great partnership with New England at MidAtlantic. When as Dr. Linda Frank was saying, we've engaged. The two regions have really engaged on LEAPP, and we look forward to future collaborations. So I think we can open it up to questions.
Thank you, Hathy. And Hathy's been amazing through this whole process. You can
well, so have you, Matt.
Yeah, well, you can imagine telling your whole group that we're switching our website, and the whole group there has been so welcoming to us coming in and working with them. And changing process is not easy, and it's not fun, and but it is something that once you do it, it can make your life a lot easier. And that's what we're hoping that we've done with our group and with your group. So.
The other thing, too, I wanted to say is that when we started working with New England, we had some of our regional partners actually talk to New England directly. So it's one thing for us in the center headquarters to say, you know, it'll make life easier. But it's another thing to hear from our own regional partners in the Mid-Atlantic how much they like it and how it's made their life easier.
Okay, he was in here.
Yeah, and he was there.
We have about 1 minute until it's a quarter till the hour. If you guys can stay on the line just a few minutes more to answer and ask questions, we are here until 2 if you need to be. I actually have a question. You may have covered this. I could have missed it. But is there a way to integrate the data collection tool without rehauling your website? Go ahead.
So that's a good question, and the short answer is no.
Okay.
The reason is that every website works off of its own database. It doesn't, it may be collecting the same type of data, but on the back end, it's all how the developer built it to interact with the SQL table that usually is the back end or whatever back end they're using. So, because of that, you may think you're collecting the same data, or you may have the same outputs, but that doesn't mean that it can interface exactly the same. And one of the things that we ran into with when we were working with New England, and sorry, I keep hearing somebody talk, so I'm getting a little bit off track here.
Interference on the line, if you wouldn't mind.
Yes. So one of the things we ran into with when we were talking with New England is that they were collecting just the basic TIFF, and our system actually requests that you collect additional information that's the user data, which has to do with like email address and a bunch of other things. So because of that, the two systems don't correlate to each other. You still need everybody to create their user account so that you can collect that additional data. And like a password and a user account and email address and a few other data points that are necessary to make it a more user identified user base rather than a anonymous user base. So that's one of the reasons that it all kind of works better.
And the other important thing about that user base that Matt's talking about, we are doing a lot of longitudinal training where we want to be able to follow people over time.
Yeah.
And unless you have something like that, and if it's completely anonymous, there's no way that you can follow people. And we're required to do that for, capacity development with individual clinicians, with clinics. So it makes sense to do it this way.
Yeah, and another thing about the user base that I didn't mention that is also really neat, and this is really neat, especially when it comes to webinars and different things like that, is that it's the same login and it's the same password for both sites. So they don't have to learn a new way to do things in order to participate with New England versus participating with us. And so that leaves a wide open area for collaboration, especially when it comes to distance-based training, because if your login is the same and your information is the same and all of your longitudinal data is being tracked, then you can log in with New England to watch a webinar on this and log in with MidAtlantic to watch a webinar on this. You can compare them and see which one's better. No, I'm just kidding. But I think it's one of those things where it's going to be really helpful in the future because we're going to be asked to collaborate more, especially when it comes to distance-based technology. You already see that happening with the national HIV curriculum. That was created for all of us. It was a collaborative effort, and it's all distance-based. And that's why they're able to make this big curriculum like that and put it in one place is because, everybody can access it. So it's the same type of idea, just with a few extra bells and whistles that happen to work better with the live or in-person programs than a online curriculum would.
And there's a question about from Maytech about wanting more information. be happy to talk with you about, if you want more details about this, we can set up a call and talk with you more about it.
Yeah, just call us or go to our website and click that contact us. That's what I always say.
Yeah.
Because that actually creates a ticket, and then so what's neat about the ticketing system is when that ticket gets created, it goes out to all of our administrators, and then we forward that to the appropriate person. So it works just like any ticketing system that you have, but also you can contact us directly. You see us here, you know us, so feel free to just call us up, and if you need I think that, let me go to the last slide here.
One of the things I wanted to say is that we're going to be doing a presentation at the All Grantees meeting on LEAPP. So if there are people that want to learn more about it that don't happen to be here today, or don't have time to listen to the recording, we're going to be doing a section at the Ryan White meeting.
So that's who you call right there. There's the phone number.
Any other questions out there or comments?
I see Clint is typing at the moment. Do you want to share a little bit about maybe what the overall cost of this might be, or that be unique to each program?
So,
we would have to figure that out.
Right.
It gets to be a little more complicated the more people that get on, but we have some ideas. So if people are interested, they can just give us a call.
yeah, so when we built this product, keep in mind, we did not build this product to distribute. We built this product for ourselves, and it's kind of like an as-is product. And so, I think, I don't know if Hathy wants to talk about this at all too, but when we first started negotiating with New England, we didn't really know how to go about doing this software as a service. And we were the first ones at the University of Pittsburgh to do a software as a service too. So there was a little bit of help there, but not as much as I would have liked. But anyway, so the whole idea of coming up with a cost is all based upon effort. So we really have to kind of figure out, what the effort would be to add you on if your group wants to join, and then we would just talk about it until we figure out how to do it. And that's, Hathy, do you want to talk about that's what we did with you pretty much, right?
Yeah, it was kind of a back and forth, and our director Vanessa Sasso and Dr. Linda Frank. I was not involved in part of the negotiations on price, so you can probably know more about that, Linda.
Well, one of the things that I think the upfront cost for us in developing this before New England wanted to be part of it was pretty significant. Every year we put money into this, for development. So. We have some general idea, but, please give us a call. We'll be happy to talk to you.
Yeah. It's not going to be, we're not charging people anything crazy, because the whole point of this is that it's the cost sharing part is the part that we're really looking for. It's not like we made this product to try and make money.
Yeah.
We're trying to cover costs associated with running the product, with staffing people so that we can support people who join the product. And so it's not like it's nothing outrageous. It's just something that we'd have to talk through.
And I would say one of the things we're getting as a value is excellent training and technical support, because I have Matt, and I literally can call him up anytime, and he's always been there to help. When you learn something, you're going to have questions, and he's provided a lot of training through webinars to all our regional partners. It's been very helpful to have that person. You know who he is. I know how to get in touch with him.
And that's part of what we would do if somebody else wanted to come on. We'd have a whole package, and that's what we did with New England. We went to their faculty development, and we did presentations to their faculty development, and then we developed a training plan for them, and then we have ongoing technical assistance for them. So it's a whole process, and it takes a while for it to happen.
Yeah.
So it's not something that you can flip a switch and it happens overnight. But I think we've got a lot of the bugs worked out of it, and now that we've brought on New England as part of this, I think it would be easier for us to bring on another partner if somebody were interested in using this particular platform.
And the frequency in which Hathy and I talked when we were first implementing this was high, right? We talked like probably every other day until we got it all sorted out. And now a weekly call is enough for us to sort out whatever idea. Well, the weekly call, we talk about ideas, we talk about glitches, we talk about what's the best way to do things, like best practices. And we just kind of work around the technology, or we talk about how we can build it better in the future, and then we create our idea list, and then we're planning on, once we get to the next stage with this, because when you do a technology like this, it's an asset rather than an expense. So you're always trying to work through that asset and make sure that you work out all the bugs so that you don't have any future issues. Because for every bug that we have in the system, that costs each of our regional partners so much time, which is so much time that they can't be spending training. And so really, it's an asset for us to try and keep making this product better. So.
And before we end, I'd really like to extend my appreciation to Matt, and Dave Corman, and Susan Winters, and all the people that are part of the MidAtlantic AETC that actually have been working for years on this product. And we also like to thank New England. We enjoy working with them, and we're happy that we can avoid duplication of effort, and we can share in this resource.
Thank you, Dr. Frank, and thank you, Matt, and thank you, Hathy, for this presentation. As you see, all the information is right here on the slide. If you do have questions and want to learn more, you can contact Dr. Frank directly. And here's some more information about the MidAtlantic AETC. And with that, I just want to let everyone know that our next eLearn call is scheduled for March of next year. If you have any questions, comments, suggestions, or thoughts about new eLearn topics for the next year, I'm happy to hear your suggestions. With that, I will say happy Thanksgiving and joyous holiday to everyone. And with that, we will end the call. Thank you, everyone.
Bye.
Thank you.
Thank you.
Bye.
All right.